Hello, I'm Dr. Richard Barth, a professor of surgery at Dartmouth Geisel School of Medicine. Today I'm going to talk about our paper, Implementation of Electronic Medical Record Interventions to Maximize Opioid Disposal in Routine Clinical Practice. The opioid epidemic is fueled by prescription opioids. They can lead to dependence and overdose in some patients, and a substantial fraction of prescribed opioids are diverted to others. Surgeons have worked hard to match prescriptions to consumption, but even if that is done optimally, over half of the patients will still have excess opioids. A possible solution to this problem would be to ensure that patients dispose of their excess opioid pills. Then there will be none left for diversion or for causing dependence or overdose. We tested whether 3 interventions could increase the excess opioid disposal rate. The first intervention was an educational brochure included in the after-visit summary. The second was a reminder in the patient portal. And the third was a best practice alert, which appears when providers see patients for a postoperative check. We had a baseline group of 500 patients who underwent surgery. We called them a month after surgery to determine if they had excess opioids and whether they disposed of them. We then applied our interventions and then queried 500 post-intervention patients. We found that a little over half the patients did have excess opioids. As shown in slide 1, our interventions increased the excess opioid disposal rate from 30% pre-intervention to 83% post-intervention, which was highly statistically significant. About half of the patients had a discussion during the post-op visit with their provider about their postoperative opioid use. The other half of the time, the providers clicked a Not Now button, which dismissed the best practice alert. As shown in slide 2, having a discussion with the patient about excess opioid disposal greatly increased the opioid disposal rate from 70% when there was no provider discussion up to 92% when there was a provider discussion. In summary, we conclude that interventions easily incorporated into the EMR can markedly increase excess opioid disposal in routine clinical practice. When patient education, a portal reminder, and provider discussion were applied, an excess opioid disposal rate of 92% was achieved. Thank you.